I just had a meeting with Kevin McCarthy, future Speaker of the House, I hope. And he's done a fantastic job for the people of California, and also the people of California have done a fantastic job. When you look at the bump, you take a look at the bump and how they're doing out there. So I congratulate everybody out there. But I thought I'd have Kevin say a few words. So Kevin, please.
Well, thank you, Mr. President, and I would like to thank you on behalf of California. Governor Newsom says the work that you're doing together has been working very closely. It's been effective in California as well, Vice President and the President. You know, today, Mr. President, I want to thank you especially for the work that Secretary Mnuchin has done, especially for small businesses. Just today alone, I saw Bank of America had more than 10,000 loans in 2 hours. And for anybody who's in small business, I had first small business when I was 20 years old. You don't have income coming in right now. You get a loan, but for your rent, paying your employees, and paying your utilities is a grant. That's part of the CARES Act. And I think you're going to find that a lot of small businesses are going to hire people back, keep them afloat through the next 2 months, and get this economy moving again as we get through this virus. So I just want to thank you for all that work.
Thank you. Great job you're doing.
Thank you.
Thank you. Today also, the CDC is announcing additional steps Americans can take to defend against the transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people that are working so hard and doing some job. Medical protective gear must be reserved for the frontline healthcare workers who are performing those vital services. The new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time. Again, we're going to all come back together here. We're going to all come back together and practicing hand hygiene, which we should do anyway. A lot of things I think are going to spill over. Shaking hands maybe will stay with our country for a long time beyond this. One of our great doctors was telling me that, as you know, we have flus every year, and the number of people killed by the flu is very substantial. It said that if they didn't shake hands, that number would be substantially lower. So maybe it'll stay. Maybe some of these things long-term will be good. But those guidelines are still the best and the safest way to avoid the infection.
Thank you for your words of discipline and determination. I guess that really describes what we're asking every American, to really be disciplined about these guidelines and really determined to stay in that space of execution. You know, we are just in week 3 of this full guidance measure. We really do appreciate the work of the citizens of California and Washington State, because we do see that their curve is different. Their curve is different from New York, New Jersey, and Connecticut. And we really believe that the work that every citizen is doing in those states is making a difference, and it will make a difference for the frontline healthcare providers. We also are deeply grateful that despite the way their curve looks today, they continue to get ready for a different potential so that they can ensure that patients, if they do get sick, have options and availability. To all the frontline healthcare workers in what we have referred to as hot zones, areas where The number of cases are quite significant. The New Orleans, the New York City metro area, including New Jersey and Connecticut, the incredible work that the frontline healthcare workers are providing. We're really working now at a much more granular level, talking directly to hospitals to ensure that they have the supplies that they need in coordination with state and local governments.
Getting the uninsured access to the care they need is a top priority for President Trump. We are already rolling out the $1 billion in funding from the Families First Coronavirus Response Act to cover providers' expenses for testing and diagnosing the uninsured. The CARES Act, signed by the President, includes another $100 billion for healthcare providers. Under the President's direction, we will use a portion of that funding to cover providers' costs of delivering COVID-19 care for the uninsured, sending the money to providers through the same mechanism used for testing. As a condition of receiving funds under this program, providers will be forbidden from balance billing the uninsured for the cost of their care. Providers will be reimbursed at Medicare rates. We will soon have more specifics on how the rest of the $100 billion will go to providers. We're working to ensure that this funding is distributed in a way that is fast, fair, simple, and transparent.
I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain.